Hello, I'm Peg Bulgioni, Marketing and Communications Manager for Southern Vermont AHEC, and I'm pleased to welcome you to Let's Talk. Our programs will be focused on topics surrounding health workforce development in Vermont. Today's show will highlight our College Student Health Internship Program, better known as CSHIP. Southern Vermont AHEC is a nonprofit educational organization dedicated to growing and sustaining Southern Vermont's health workforce, especially in our rural and underserved communities. Welcome back to Let's Talk, and I'm pleased to introduce my guest today. I have Susan White, who is the Director of Health Careers Preparation with Southern Vermont AHEC, and she is joined by Arwen Turner, Executive Director of Come Alive Outside, and our CSHIP intern, Keelan Boisvert. So it's great to have you all on the program. Welcome. So I think we're going to jump right in because we have a lot of things to cover. So Susan, let's talk about the CSHIP program, just to give a little context to things. So why don't you tell us a little bit about it?
Okay, thanks for having us here. So the CSHIP stands for College Student Healthcare Internship Program. And AHEC recruits and matches undergraduate students with health-related organizations in Vermont who have a project that a student can do. The goal of this program is to provide experiences to students who want to pursue a career in healthcare or healthcare-related profession, and also hopefully provide a rewarding rural experience. AHEC is about healthcare workforce development in rural areas. So that's part of what we're trying to do with the CSHIP program in Vermont. And these are paid part-time internships, again, for undergraduate students or students pursuing a post-secondary program. Most of our internships have become remote over the last couple of years, though there are some that are in person. And they're 50 to 100 hours, mostly in the summer months.
So how do students apply?
So students apply, our applications open in January. So students can apply either at our website, Southern Vermont or svtahec.org, or you can just Google Southern Vermont AHEC. Or we actually use a platform that our college and university career centers use called Handshake. And that's where employers post jobs and we can post internships. And so students can apply for that. And the general timeline is that, again, applications start opening up in January, and we try to match, late March, early April to May. And again, the internships are generally in the summertime.
All right. So let's talk to Arwen. Start asking her some questions, because you have an intern working with you this summer, Keelan. So why don't you tell us a little bit about the type of internship she's doing?
Yeah, so we actually have two interns from CSHIP. We have Keelan and Maria, and we have been talking about having interns for 2 years with Susan, and finally this is the year where it worked out. So they're working with us with our Nature RX program, and what that program is people get referred from their clinicians, or they self-refer to spend more time in nature for health, wellness, and joy. And we find that this program works most successfully when we have someone who's able to do one-to-one coaching with these individuals and help them set weekly goals to spend time outside in whatever way meets them where they're at. So our interns this summer are doing 100 hours as wellness coaches, and they're working with 25 folks who have registered for the program. And Keelan has 12 of those, and then I believe that Maria has the other 13.
Okay. So Keelan, how would you describe your internship experience to other people when they ask you what you're doing? I know Arwen spoke about that, but maybe you can give us some additional insight.
Yeah, I would go about it just by starting with it's working with the community health organization in a rural area to help those who don't have the confidence to get outside, or don't have the confidence or resources necessarily to exercise or engage with things that reinforce their own well-being. And my role in that is to help them one-on-one really foster that confidence and foster that motivation, and reach their goals, and however they want to get outside, and like what Arwen said, meet them where they're at.
So what would a typical day be like? I mean, do you have these folks like in a queue that you contact and meet with every week or every other week?
Yeah, so I contact them once a week, and they can list out whether they'd like to be called, emailed, or texted. Most of my clients like to be texted, so I have them as my personal contacts, and we have really fruitful conversations every week. I typically try to contact them Monday to Wednesday, just so they have enough time for the end of the week to focus on themselves and to focus on the goals that they want to achieve. And we talk about how their previous weeks went, what they were able to do, what they weren't able to do, and what they want to try to do differently, and what I can provide in helping them, and what motivates them to reach their goal.
So Arwen, what kind of outcomes are you hoping to get from this project?
Yeah, so all of Come Alive Outside's programs measure 3 similar outcomes. So we're measuring, is there an increase in mental well-being? Is there an increase in physical activity? And is there an increase in time spent outdoors? And those are kind of our short-term, immediate outcomes that we're looking at. We're also looking specifically with this program about retention of folks in our other programs. And what we find with this program is that we're increasing self-efficacy, and that we have a really high retention with folks from this program entering in through the other programs. So other programs might be the Mile a Day program, or our Adult Passport program, or folks, we see them come to our group events that we're hosting. And so that's one of those medium-term goals, and we're seeing that it's become quite successful, specifically with NatureRx, and we think it's because of that one-to-one attention that they got when they first entered into Come Alive Outside.
So how long do they stay in the program? Is there a timeline or an expiration? Or?
Yeah, so the program's in a cohort. So we used to have 2 cohorts a year. So we had a spring and a summer cohort. And then we did a project with UVM where they looked at the program, and we realized that if we had one longer program, that would actually fit people's needs better. So we have some people who enter in just once, and then they might feel like this program has helped them meet their needs, or maybe it wasn't a good fit and we don't see them anymore. Or we have folks who've done the program for multiple years in a row. And I think some of yours are returning folks, and some of yours are new folks. You might have 1 or 2 of them that have been people who've done it for 4 or 5 years in a row. So it's really, we're all on a different path and journey when it comes to our wellness and what we need. So some people might only need it once, and some people really like it, and so they feel that they need it annually.
That's great that there's no limits, that they can just keep coming back if they want to. So Keelan, what are the 3 most important skills that you are learning from this internship?
Yeah, I would say accountability is a big one. Showing up for the people who are participating, and not dismissing what they have to bring to me, and really listening, taking the time to hear what's going on in their lives and what's difficult for them. I would say empathy is also a big one, and my experience with coaching, displaying empathy and understanding really brings people closer to you and allows for a fruitful coaching experience. And I would also say communication is a big one, especially over texting. It's a whole different ballgame when you're trying to learn how to display emotion and understanding and not just sound robotic. And so my experience coaching previously was in person, or over the phone, or on Microsoft Teams or Zoom. So I could see the person or really hear what they were saying to me and how they were saying it. So really understanding how to word things and being very deliberate with what I say and how I hold space for them.
That's great. Susan, I know that you've been working with students for a number of years on these types of internships, and what do you think they're taking away from it, or what have you heard?
Yeah, I think she certainly, Keelan mentioned communication. That is a big one. I have seen a lot of students talk about time management.
Yes.
They're working independently, since most of them are remote, and have deadlines. So while they have that at school, it's a little different still in the workplace. And I think a big piece is they also learn about community and public health, and how that plays an important role in our healthcare system, Students see the social determinants of health sort of up close and personal, and how they can be a barrier to individual health.
Yes.
They also, hopefully, or in some cases, have definitely been introduced to a new health career, which they may not have even known about. I have students particularly that work with prevention organizations that had, I had no idea that prevention was like a career path I could do. And then also even seeing what is really public health. Students who've been assigned or matched with a public health organization. What does that mean on the ground in real life, in real time? And they're in design, the internships are designed to engage in at least some of the career competencies that are designated by a national association. So the communication, one of them, critical thinking, problem solving, teamwork, collaboration, and certainly professionalism and work ethic. Keelan mentioned, having to set up your schedule for the day or the week. And yeah, those are big ones that students can take away from.
Yeah. Well, I know there's probably been a big change since the pandemic, because a lot of these internships had to flip and become virtual versus in person. But it's nice that the students are learning to adapt to this new normal, because it's challenging. I've talked to a lot of interns, and they've shared their, not frustration, but it's different. It's very different.
Yes.
And I'm sure that you just remarked how different it is.
Yeah.
That there's nothing like that in-person face-to-face contact.
Right.
Yeah.
But I will say that some of our organizations often say they embrace the remote because they don't have physical space necessarily in their office or the equipment, for a student. And I know that a lot of students do like the remote, because these are only part-time internships. They're only 50 or 100 hour. So students are working, they're doing some travel, they may be taking a class, and being remote allows them to manage both. And again, that gets into time management for them. We do like to encourage and have opportunities for in-person in Vermont, so we very much like to do that. And when Keelan gets a chance to come down to Rutland, that's great.
Yeah.
So we liked the hybrid version, but also to offer that.
Well, I think this is becoming more common too,
Yes.
not just with CSHIP interns, but internships across the board. Arwen, how do you think Come Alive Outside has benefited from having interns?
Oh my gosh, there are so many ways specifically with this program. I think the first one is this is something we wouldn't have had the resources to be able to do on our own.
Right.
And to be able to have 2 extra staff members who are more qualified than us to do this job has really, really shown us what this program can really be. And so Keelan is actually a certified health and wellness coach. And so a lot of people in our programs, to pay for a health and wellness coach on your own can be extremely expensive. And in this program, for the duration, they get one. And so Keelan has skills and knows how to drive people towards goals and have conversations and listen and do things that we don't know. Like, we are great at getting people outside and we're great at building community, but we're not health and wellness coaches. So that's just been really amazing to see. And we see that in the impact. So I was just looking at the numbers yesterday to brush up before I came here, and seeing the mental health increase from people from week 1 to now is the highest that we've ever had. And that is not a coincidence. It's because we have really great people doing these, being our coaches this year. So just thank you so much for everything that it's you.
Thank you.
And Maria is also in the coaching
Yeah, and she's
programming,
doing
so,
amazing. And and like, it was like every single person's was a drastic increase. And then the notes are detailed, and the ways that they're helping people get outside are different than we've ever seen. So it's like you're really, really listening and directing them, and it's led by the person in the program. And then the other thing is it's freeing up us who are local to be able to do more in-person events that are engaging and different. And so Rudy's around here somewhere, but he is our program manager. And so this coming up weekend, we have 2 events for our Nature RX folks. We have a poetry picnic where we have the president of the Poetry Society for Vermont is coming to lead a workshop on nature poetry. And on Sunday, we have a cooking class with Chef Nate from Marble Valley Kitchen. And so these are things like, when we're running the program on our own, we don't have the mind space and capacity to think about ways to engage people in outdoor fun that also gets those outcomes. And when we have people to help, we can do things like that. So all around, it's been amazing.
Great. And Susan, I'm sure you can echo what Arwen had just said, because we've talked about it, that a lot of employers have been thrilled to have the interns because they don't have the capacity.
Right, it expands capacity
Yeah.
of our organizations that are, have not too many rain out events outside with the summer reading out.
So Come Alive Outside has some sort of
canopies.
magic.
Oh, they have canopies, okay.
But every time we just say, don't rain, and then it doesn't rain on our events. Like,
It's very powerful this
Don't
morning.
rain.
That's right. No private joke.
I know who to call now when I have an event then outside.
Oh, that's right. Arwen, yes, she's got superpowers. I will say that.
Good to know. Good to know.
So Keelan, what do you really love the most about this internship?
Oh, goodness.
And you could say more than one thing.
Okay, good. I was hoping for that. I would say this is my first real professional experience engaging with participants and clients outside of schooling and outside of training. And to really see how I'm working with people and developing relationships with people I don't know. And seeing how we can work together has just been very fulfilling and I'm very grateful for it. And also meeting Arwen and understanding more about what's out there for community health and learning more than just what you're taught in the classroom and really seeing how it applies to real people and seeing the changes that can be made in their lives. It's definitely those are my top two favorite things. I could go on for a while, but
No, that's okay. And so what are the challenges you faced with the internship, if any?
yeah. I think I hinted at this a bit earlier, but really adapting to remote style coaching, but more specifically texting, because I feel more comfortable being able to read somebody else's emotions based on how they talk or how they look or their body language. And that's so much of what you're taught in health and wellness coaching. So to take that and take my understanding of that and try to apply it to a text model or a call model it was a little tricky to adapt to at first. But over time, I discovered how specific people wanted to be talked to, what got the best reaction, what made them the most comfortable. So in that way, I think I learned a lot about being deliberate with communication and being able to read people through a machine, honestly, which is really interesting to say out loud, but it is very true.
So if you were explaining this internship to a peer,
Yeah.
how would you describe the benefits? How would you encourage them to do an internship?
To do an internship,
Well, especially with CSHIP.
with CSHIP, yeah. I would say, I would first try to establish an understanding that getting an internship in college can be very, very difficult, especially in the healthcare field, when you don't necessarily have a degree to back your education at that point. I would go about it by saying, look, there's this CSHIP program and there are organizations that want to allow you to get this experience in the field before you're just sent out of college. And I would say they're student-focused companies and student-focused programs that want to help you and want to help you engage in real-life public health, community health experiences, and that's what I'm doing here. And there are ample opportunities to do so.
Yeah, I think ideally that is what an internship does and provides for an undergraduate
Yeah.
student, is an opportunity to use their skills and knowledge that
Yeah.
they may be learning in class to apply it then to a situation. And then I just read an evaluation from a student that completed an internship this summer, and she's excited to take what she learned in the field back into the
Yes,
classroom. So
that's a big one.
Yeah.
Yeah.
Did you do an internship last year?
I
too?
did.
So it's a different kind. It wasn't the hands-on thing,
Yes.
but so occasionally we get interns 2 years.
Me.
This is great.
Yeah, that is interesting. So Arwen, what is your impression of Southern Vermont AHEC and the CSHIP program in general?
Oh gosh, this has been amazing. Like, it's the greatest thing ever.
Keep talking, keep talking.
But really, for us as an organization that is growing really quickly and needs people who are very capable, like, I could not be more pleased, and I hope that we can continue working together because this has been spectacular. So I think also, like, knowing that there is an opportunity for folks who don't have their degrees yet to get their feet wet in public health, and maybe fun ways, like working with organizations like ours.
Yes,
yeah,
definitely.
I think it's great all around.
Yeah.
So Susan, well, I know did you want to say something?
Well, I was just going to say, again, it's an exciting partnership with UVM's health coaching and integrative health program, and giving students an opportunity to actually practice the skills that they're learning. So we're excited about that.
So Keelan, you go to UVM.
I do.
And what are you majoring in?
I'm a health and society major. So
Health and society?
Yes.
You're going to have to explain that.
It's a pretty loaded major. There's public health involved. There's some of the standard biomedicine involved. There's some anthropology and sociology wrapped up into that, as well as some behavioral sciences. And I have minors in anthropology, integrative health and wellness coaching, and behavioral change health studies. So that's my
Full class
degree.
load.
I'll say. So how does this translate into a career path?
With that education combined with experiencing internships through CSHIP and with health coaching, I'm hoping to take it one step further to a holistic healthcare, more specifically osteopathic medicine. So that a synonymous career to an MD, so your standard Western doctor. The DO route takes you a bit more towards alternative practices of community health, public health, anthropology, really wrapping up medicine, Western biomedicine with different aspects of holistic care. And I really feel like my education in undergrad, grad, and through internships will lend itself well to that.
Now, are you from Vermont originally?
I'm not.
Okay.
No.
Do you think you might stay here?
I do. At least, maybe not initially, not fresh out of undergrad. I aim to do research and travel a bit, looking internationally for that. But I do fully believe I'll end up back here. I feel like this is the place to be for what I want to do.
Well, we hope you come back.
Oh,
Definitely.
Thank you very much.
Exciting.
So, Susan, I just wanted to kind of ask a few more questions. The internships that students do, they do them primarily over the summer.
Yes.
Correct? Okay. Are there any internships that take place during the fall or the winter semesters?
Sometimes the students' projects from the summer carry over into the fall, so we sometimes have them definitely continue into September. We have a couple of those this year, if the students' availability. Once in a while, if our funding allows and we still have an interest from an organization and a student, we could do them during the year, during the fall or spring semester. We don't have a lot of them. Usually they're focused in the summer, but we would be open to those, again, depending on funding and availability.
And Keelan, are you graduating this year or do you have another year?
I'm entering into my senior year, so I have another year.
Okay.
Yes.
Okay.
Yes.
And you mentioned osteopathic medicine. Do you want to be a DO? Is that kind of
I do.
the goal?
Very much. That's the end goal. On top of the majors and such that I've discussed, I'm also getting my master's in public health in an accelerated
Oh, okay. Okay, so you'll
Opportunity.
graduate with a bachelor's
and a master's.
and a master's. Wow. Very ambitious.
Yes.
So, Arwen, the wheels are turning. Are there other internships that you're thinking about that CSHIP there might be a match for down the road?
Yeah, I mean, we would love to repeat this one. The other things that we have coming up is our Outdoors for All programming that we've been starting in the last couple of years has really been taking off. And so that's the programming that's focusing really on looking at the barriers, opportunities, and interests for people who are historically disenfranchised in the outdoor recreation to take up more space in that. And so it would be great to see how maybe we can have some interns participate in that work, because I feel like for our community, that's helping us increase health equity. And so I think that kind of brings it full circle and might be something that some folks, you got me, sign me up for a third year.
All for it. All for it.
But yeah, I mean, I think there's always opportunities with Come Live Outside, and we continue to grow too. So maybe some of these interns could come back and work for us too.
That's right. That's right. That's right. Susan, not to put you on the spot, but I am going to put you on the spot. What are just give me a couple of quick examples of some of the other CSHIP students, what they're doing this summer.
Yes, we have had some students involved in like health equity projects. One researched some LGBTQ health equity best practices, and then compiled a report, which then presented a plan for partnering with other health providers. Somebody did actually developed and conducted a survey of area dentists to help determine some of the barriers for dentists taking Medicaid patients, and then that information will then be presented to an oral health coalition that's statewide or region-wide. And then we actually had a student do an audit of accessibility in a community to the physical resource. This is one that was an in-person one, having to do with access to green spaces, community spaces, including condition of sidewalks. So that was kind of different, but has to do with, again, health equity and access. So, and then another Rutland one is a student helped assist a startup company that's developed like a virtual reality medical training tool to train healthcare professionals on the emergency code cart. And so her job is to recruit healthcare professionals and students to test it out and then provide feedback for quality improvement. So that's been very exciting and pretty fun to be involved with that. And that's tacitly right here in Rutland.
That's right. Yes, I've spoken with Maya, and she's a remarkable young woman, and they're doing incredible things over there.
Yeah.
So I predict I don't know if they'll be the next Apple, but they're definitely on their way in terms of virtual reality technology. Yes, definitely. So we're kind of getting to the end of the program here. I didn't know if anybody had any final thoughts. Arwen, did you have anything?
Just a lot of gratitude. Yeah, that's all I have. Thank you.
That's all right. We'll take it. We'll take it.
Come Alive Outside is a pretty unique program, and our students get excited about it when I talk about it. So we'll see what else we can do, continue to do.
Yes, she's done a fantastic job.
Yes,
elevating the program.
And I was very excited to see the applications come through for the Maria and Keelan who have this training and background in education. That was like, whoa.
Yeah. I'm sorry that Maria couldn't join us today, because that would have been nice getting her perspective, but we're very pleased that Keelan drove all the way down from Burlington.
Yes, that's right.
And hopefully you didn't have any trouble finding the studio.
No, I did not, thankfully.
Good, because it can be a little tricky when you're trying to navigate down in this neck of the woods.
Thank you for the directions.
My pleasure. But Susan, did you have anything else?
Just we're always excited to look for new partners, organizations that want to utilize the gifts and skills of interns and college students. So we're always open for placements that way.
All right. So thank you all again for coming on the show and sharing this information with our viewers. And I think I'm just going to sign off and say thank you for watching Let's Talk.